Mental health is a person's condition regarding their emotional, psychological, and social well-being.
It determines how we think, feel, and act. Mental health issues are as common among students as they are in the general population. Alan Percy, Head of Counselling at the University of Oxford, says, "A lot of difficulties are not caused by medical problems, but by normal life problems, such as family or relationship issues, or anxiety about their work. While these problems are distressing, through counselling we can help students to understand them, and then suggest strategies for dealing with their feelings." Mental health concerns for students can stem from various aspects of a student lifestyle, for instance, immense stress in regards to academic studies or loneliness.
Depression and anxiety are two of the most common types of mental health illness in the student community. According to the NHS, depression is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. Fortunately, it is also treatable. Depression can cause feelings of sadness and loss of interest in activities once enjoyed. It can potentially lead to a variety of emotional and physical problems and can decrease a person's ability to function at work or at home. There are many signs of depression and anxiety, including feeling low, feeling more anxious than usual, losing motivation. Some people also put on weight, stop attending lectures, become withdrawn, or have sleep problems. Anxiety is a feeling of unease, like worry or fear. It can be mild or severe. Everyone can feel a degree of anxiety at some point in their life, e.g., you may feel worried and anxious about an exam or a medical test or an interview. At times like these, feeling anxious can be perfectly normal. Although some may find it hard to control their worries, the feeling of anxiety are more constant and can often affect their daily lives.
Depression makes students feel helpless and despondent. It affects their work, their life, and their ability to learn. They tend to withdraw themselves from the society, wanting to be alone. People around will feel a sense of helplessness and they will feel guilty. Depression doesn't only affect an individual, but everyone around.
Yes, mental illness can be treated. There are so many different ways and steps to solve mental problems. But let's see the leadership response we could give to such an issue. First actor that could act as a leader with a mental ill is actually the ill itself. In fact, people with a mental illness can do lots of things for themselves, especially to self-motivate for their goal, as a team leader will do. Self-help solutions are simple, but that doesn't mean easy. In places such as the Wellbeing Center of the University of Exeter, they can be given the tools to overcome challenges by themselves in their own time and pace. Also, professional solutions can be considered as leadership responses, as health professionals will play the role of real managers in the healing process. Peers can also act like leaders of achieving the objective to recover health. They are the one that will give the ill the confidence and support he needs, since understanding and acceptance by the community is also very important.
The best solution for the treatment of mental illness varies according to the individual's needs and lifestyle, but it's important to work with a medical professional regardless of the type of solution you choose. We have recognised that the issue of mental illness is a rising one within our community, and understand universities and the NHS may face many challenges trying to deal with the rising number.
The effects of the treatment can be negative for the community in terms of high expenses for the NHS. Additionally, according to our observations, we have noticed that the Wellbeing Centre is oversubscribed, suggesting a lack of skilled workers. As for individual, treatment requires constant help and it is a long-term recovering process. However, taking steps to seek help results in good mental health. For instance, it reduces feeling of stress, brings a sense of calmness, and also can increase self-esteem.
In conclusion, there is a rising number of students in our community suffering from a mental illness. In this video, we have explored the possible symptoms of mental illness and examined the various leadership responses to this issue, which we have concluded starts with the individual. This is an issue that requires more attention, but we have considered the likely effects of addressing this challenge and the implications for both the community and the individual.